Welcome to the Medical Device Made Easy podcast, the podcast that helps you to place compliant medical devices on the market. Here is Monir El Azzouzi from easymedicaldevice.com. And today, for this February review, we'll check all what happened in February and all what maybe will happen in future. Okay, so we have to start with that because everybody's talking about that. So we have to start with the coronavirus. So it's not specifically a medical device topic, but apparently it is, because there are a lot of information that are coming from some manufacturers saying that there is some difficulties to supply some products from China because this situation with the virus that happened in China made that there was a lot of companies that stopped to work, put their people in quarantine, just waiting that the virus is stopping. And this made really a lot of difficulties for some of the manufacturers in Europe because of that. So there are some situations where some manufacturers are even thinking of having some stop of supply, having their people in holidays, just waiting that everything like that is going out. But there are also some strange situation, or if I can say, it's that everybody starts to want to sell medical devices on the market, but they don't know that there are some rules. So some people like anybody on that you know are just deciding from one day to another, oh, let's sell some face mask or those kind of things. Just a reminder, this is a medical device, so you have to comply with some medical device rules, and you have to avoid to sell, if I can say, some products that are not conform to the regulation or mislabeled. Or I have seen some people that said, oh, the mask is already expired in 2014. Can I just change the label on it and put 2021? So yeah, this is not allowed. So please don't do this kind of thing. At the end, there is some public health. So don't do that. One thing that is important is just wash your hand to avoid to touch your face and to do all those things because you can spread the virus just by touching something and then touching your face. So wash your hand as a maximum, use sanitizer and for your hand, and then we hope that everything will be fine. So please also consider that what is happening in China will have also some repercussions in some medical device fields, like the notified bodies. There are some notified bodies that informed that there will be some delay for some audits. We can understand. It's like any other company. We are trying to protect the auditors to not get also the virus and then to spread that to other companies also. So it's something that is normal. So you may also see that. It's really difficult because we had already a shortage on notified bodies for the MDR, and now with the coronavirus this will be, if I can say, delaying some audits to happen. So we will see what is really the situation about that. Next topic, we'll talk about the MDCG committee. So in February 2020, there was no new guidance. I checked and there was no new guidance issued. So there are still a lot that are missing. So no new that happened. And in March 12th, 2020, there will be a new meeting for the MDCG committee, and they will talk about a lot of things, but some of the things are, for example, the Udamed state of play. So what is the situation with Udamed? We are really waiting for that because I have a lot of manufacturers that are still continuing to say to me, oh, I have to register my products or my economic operators in Udamed before May 2020. And I say, Udamed is not live, so how can you do that? And they don't really understand this point. So it would be great to have more clarity about that. Don't forget also to go to Richard Julian's trainings. He is now doing a tour, so check where he is now and try to contact him and ask him when is the next session, because I think it's important. And Richard also created some templates or some documents that can help you to already start to store your data for Udamed. So when Udamed will be live, you can then directly populate that and send that directly to Udamed. So you can go to my website, so easymedicaldevice.com/shop, and you will find on it some of the templates. So and then you can contact also Richard if you have any question. They will also talk about the notified body situation. I would really like to know what is also the situation. So I will also show you later the different the situation about notified bodies, how many notified bodies happen to be notified in February. But yeah, what is the situation? Because actually a lot of people are, if I can say, in stress because they don't find notified body. Some people are also asking me, do I need a notified body? So this is also some points that we are trying to clarify now with some of the manufacturers. So it's not really, if I can say, an easy situation for anybody. The last point that I saw on the agenda, which was interesting, is about the guidance related to MDSAP, so MDSAP. So apparently maybe the European Union is starting to think about that, how we can also integrate the MDSAP program. I don't know. I'm just assuming from what I see on the agenda, but I would be really also interested to hear more about that. Okay, so now for notified bodies. For notified bodies, so we had in February 2 new notified bodies. So we had in Norway, DNV GL Presafe AS, so it's a big name, so coming from Norway. And we have in Ireland the NSAI. So we were really waiting for this one in Ireland because it's a famous one. So it was, if I can say, normal that he get it. But yeah, we were in hope because the process is not so an easy process. So we never know who will pass or not pass. So let's make a count per country. In UK, we still have BSI UK. It depends on Brexit situation by end of December 31st, but we still have BSI UK, and they will still continue to be a notified body until end of December, until there is really a clear decision. Maybe after December, but until December for now, December 31st. In Netherlands, we have 3 notified bodies. In Germany, we have 4 notified bodies. In Norway, so 1 notified body. In Italy, 1 notified body. In Ireland, 1 notified body. And for the end, 0 notified body for France. So I'm still desperate to find a notified body for France. So please make one for France. So as I've said, notified bodies are really important for our industry. They are, without that, you cannot place a medical device on market unless you are class 1. But this is really important. So we are trying to encourage them to really be accredited for that. But there are some stories about notified bodies. We talked about that also a lot on some of our podcasts or some of the videos that I've made, is the fact that there are a lot of manufacturers that are now trying to contact some notified bodies or they don't answer, or they say they will put them on a waiting list, etc., which is a difficult situation. I have also other stories of manufacturers that are trying now to get MDD certified for some of their products, and some notified bodies are raising the price ×2, if I can say, to get this certification, which is not really a fair playing, if I can say, with that. So the issue is the fact that notified bodies can do whatever they want in terms of pricing if somebody at the end is accepting to pay that. So it's fine, but it would be great that we are still remaining with the same price as before. When we have small manufacturers with one product that try to put a product on the market before date of application, the fact to raise the price is not really fair. But it happens, so don't be surprised if you see that, because it's the offer and the demand. So you need more of them than they need you. So if I can say so maybe it's why it's happening like that. Okay, some situation in the USA. So in the USA, we have a lot of guidance that are issued, and it's really interesting because it's a lot of guidance on some products, on things. So it's something that I really encourage you also to go and check, even if you are in Europe, because it can give you also some idea of how you can market your product, so how you can provide some evidence that your product is safe and performant. So I will just touch based on 2 guidance. So we have the guidance related soft hydrophilic daily wear contact lenses. So this is a draft guidance. So it means that you can go there and you can have your comments so that they can take that into account if they want to modify it. So it's a draft guidance. Go check it and provide your comments. The second one is a guidance, not a draft guidance. So it's already published. It's a bone anchors. So it's mainly for orthopedic. If you are manufacturing bone anchors and you want to submit a 510K, there are all the information regarding that. So they give you really what information you need to provide, all the details. So it's a good help if you are specifically on this area. A last information is that there was a ban announced recently in the US. It's about a ban of the electrical stimulation devices. It's the devices that you are using for self-injurious or aggressive behavior people, so mainly some psychiatric people sometimes. So the thing is the fact that they find that it has no real effect, or it was not really performing as expected. So it's it's mainly, I think, those devices that you see on the movies when they are putting that on the head of the people to have some electrical effect on them. But yeah, apparently there is a ban now, so all the devices that are in use will have to stop. All the people that are in the middle of a treatment can continue until the end, but under the supervision of a physician. So there are, as I've said, a lot of information in the US related to medical devices, so it's also a good source of data that you can go and check on fda.gov. Okay, now let's summarize quickly what happened at Easy Medical Device this month. So first, yesterday I was two last days I was in London, so I was having a lecture, a training with Topra. So Topra organized a training on design and development of medical devices. It was really a great training. A lot of good topics were mentioned inside. So I had to present the topic of MDR and Brexit, which was really an interesting one because there was a lot of questions. People asking what will happen after the transition period, what is happening now, are we in Brexit or not, what should we do? And what I mentioned mainly that a lot of things that we are saying is fictional, because as long as we don't have the information from the UK and Europe, what they will decide, whatever we are saying is really fictional. So, but as Eric Volbrecht says always, you have to make scenarios. So even if it's fictional, take that into account to prepare already. For example, if we have a full exit of the UK, then you need to have an authorized representative and an importer. Don't wait until December to choose one. Already start now to make your selection, to make your investigation, and to find the right one for you. So yeah, it's important to make scenarios. So make scenarios in one way or the other. If you are really interested to learn about medical devices, to have really a good training, this one about design and development of medical devices made by Topra was really great. So try to contact Topra to know when is the next session if you really want to participate. But it provides you really a lot of detail. A lot of speakers also are coming, specialists on their area. So it's really helping you to get really the right information. Okay, on the podcast, what happened? So we had a few topics discussed. We have the Swixit with Ronald Boumans, where we discussed about the situation in Switzerland. So I remind you, if you are located in Switzerland, if you are a legal manufacturer in Switzerland and you are selling your products to Europe, actually there is no deal for MDR with Europe. So you have to look for a European representative, European authorized representative, and an importer. So look for it now. I mean, don't wait, because apparently Switzerland is already saying take the worst case, we will maybe not have any deal. So you have to have that available. So go back and listen again to the episode with Ronald Boumans about that if you want to get more detail. We also discussed just after with Eric Volbrecht regarding Brexit, Swixit, and also Turkzit, which was something also interesting. So we discussed about Brexit, and to say that mainly it's business as usual for now until the transition, the end of the transition period. And about Turkzit, is the same situation as Switzerland. So mainly there is a renegotiation of the agreement between Europe and Turkey, and I'm trying to find now somebody to help us to really get some information about what is happening in Turkey also. So be ready for all those political situation where people are really trying to negotiate, but it's more political than kind of safety things. So at the end, you are ready to continue to place compliant medical devices on the market. Then what we had the clinical data for low-risk devices with Robert van Boxtel, which was really interesting, where we are helping you to understand what kind of data you can provide to show that your products, which is a class 1, for example, is really low risk, to show also that the benefits are higher than the risk, etc., etc. So go back and listen to this episode if you are missing some of the clinical data for your products. You need clinical data to place your medical device on the market. So you should have that even for class 1 devices. And last one was about how to write your intended purpose with Cesare Magri. So this is also something that is important. If you don't write them correctly, you can change the class of your device. You can have less. The scope is maybe lower than what you can expect, or it's larger because you are claiming a lot of things that are not really true. So look back at this episode because we had really a great discussion with Cesare. It provides you also a document where you can use it to create your intended purpose with the different steps. So don't hesitate also to go there and look at the show notes and download the documents, because I think a lot of manufacturers are not doing that correctly. So if we can help you to do that correctly, it's really great. Last point. So mainly we had also some episodes, bonus episodes. This month we specifically focused on economic operators. So we had a series with Eric Volbrecht where we talked about who are your economic operators, who controls your economic operators, what your economic operators should check, and also if they need to have a quality management system. We will maybe have more, because I get more and more questions about economic operators, so I will try to register more episodes about that. And don't hesitate also to go on my shop. So if you are looking for some templates for your agreements, I created some agreements regarding supplier, distributor, importer, authorized representative. I am also working now with the lawyer to prepare the one for PRRC, so how to appoint your PRRC when it is an external one, like a consultant. So I'm trying to get that also to help you really to be on the safe side. Next one is a good exercise that we are doing actually at Easy Medical Device is a LinkedIn Live. So I am trying to invite some people to do some lives with me. So we had some lives like with Stefan Bollinger about quality management system for software devices or for class 1 devices. We had also Marcelo Antunes where we talked about the changes to the ISO 14971. Please go there. It was really an interesting one. There was a lot of discussion about if this is a mandatory standard or not. It's not harmonized, so should I use it or not, etc., etc. Marcelo really provided excellent information about that, so don't hesitate and go and watch that again. We had also the one with Ivan Perez Chamorro about worldwide regulatory affairs and quality worldwide data for 2019. So he provided to us all his database with a lot of graphics to show to us which domain was really interesting for the people that are using the MedBoard database. What is the best search that happened? Which country is providing the more information, etc., etc. So it was really a lot of data. The only thing is that I had an issue recording that with my license, with my provider, because I didn't know that my license was over, so I couldn't record that. So it is still available on my LinkedIn feed. So if you go to my LinkedIn, all the feeds that I have, there is a picture of that. Or if you go to Easy Medical Device page, the page of the company, then you can go on the feed and you will see that also there. So it's the episode with Ivan Perez Chamorro. So sorry for that. I was expecting to have that on my YouTube channel also, but couldn't get the record. Then last one, and really a great one, which was about Annex 16 products. So you know that with MDR we have now the Annex 16 products, which are products that are with non-medical purpose. So Eric Volbrecht and Stefan Bollinger were with me. It's like a panel discussion, so I received a lot of questions about Annex 16 products, so I decided to ask them, and then they were answering to me and telling me exactly what they think about that. So it was really a great topic, also great discussion. If you are a manufacturer of those kind of devices, if you go to this episode, you will see everything, you will hear everything that you need to hear regarding that. I suppose it will answer all your questions, but if you still have some questions, please put that on the comments under the video, and as soon as I see that, I will or answer or try to get Stefan or Eric to answer. So don't hesitate to do that. If you have also some other LinkedIn Live that you want me to perform with some topics, let me know also. The LinkedIn Live, as I've said, what is interesting is the fact that we can make a presentation, so we can show some slides, and we provide you the slides just after with the replay. And there is also an interaction, so people can ask their question, and I can answer to them, or we can answer to them, which is really a good way, if I can say, to directly get the question instead of waiting maybe to see a comment. So don't hesitate if you have some other LinkedIn Live topics that you want me to prepare. I will be really happy to contact the right person, or to do it myself if I can. Okay, it's the end, I think. So we are. I'm trying to do those kind of review every month, so to see what happened. Let me know if you like that. Let me know also if it's some interesting information that I'm providing. And I remind you that I'm also driving my consultancy company. So if you have any need of a support for MDR, for IVDR, for MDSAP, for any medical device topic, let me know. I can help you, or I can find the consultant that will help you, because the objective is really that we help you to place a compliant medical device on the market, and for that we need really to get your information and all the questions that you have, so we can really help you. So don't hesitate to contact me at info@easymedicaldevice.com. Send me just an email, and I will try to answer to you as soon as possible and provide you with more detail. And we can maybe also have a phone chat or video chat, so that I can understand better your situation. Okay, so thank you for your help, and don't forget to go to subscribe to the podcast, to the YouTube channel also, and please also provide or share all those information with your colleagues that need to learn more about medical devices, because I think it's really important that we are spreading the message to everybody, and that they really understand what is happening with these new regulations, not only Europe but everywhere. So we are trying really to cover everywhere. Okay, great. So thank you very much, and I wish you a nice day.